foods that you can digest, that you can digest, that you can assimilate and eliminate. Because if the foods you eat you, that's not good. And how would you have any ideas, unless you were an immunologist? How many immunologists in the audience? Right? So I can say anything. No. My mom wouldn't like it if I said anything. You are probably all aware that when your body works correctly, what you see tells your brain what you're going to eat, and your brain then tells the digestive tract what to prepare for. So the first step of digestion is the eyes. The second step of digestion is the mouth, where you taste and smell the foods, which further tells the body what the foods are that it needs to digest. If you follow the American tradition of opening your mouth, sticking out your tongue, saying, "Look out, stomach, here it comes," if you follow the standard American diet, which we write so often that we abbreviate it SAD, and we think the standard American diet is sad. If you wanted to do an experiment on how to increase chronic disease, how to decrease quality of life, how to promote suffering in later life, you could do no better than the standard American diet. I was talking to a fellow just Thursday, just a couple days ago, and he's Persian, and he's not a doctor, but he's an engineer. He's a sensible fellow who has a very serious medical challenge in front of him. And he was very clear that the choices we make, including the choices of the foods we eat, contribute to who we are. One of the people I studied with summarized his life's work as follows: we are and become what we eat and drink, think and do. So mental and physical activity is important. Relationship and environment is important. What you eat and what you drink is important. And these are choices. The fuel you put in your vehicles, to some large extent, determines the quality of how that machine runs. And while your body is not a machine, it's machine-like. And the quality of the food you put in determines the quality of the fuel you have to use. And I maybe at this point should explain to you that everything I'm going to tell you is what I disagreed with when I was at the National Institutes of Health. So I was trained in Boston, then I got to the National Institutes of Health, and I heard that diet and activity were important. I heard that attitude and environment were important. I heard that acupuncture was not a placebo. I heard that the mind influenced the body. And I was very sure that that was not true. And the reason I was very sure that was not true is because nobody taught me about that in Boston, and nobody taught me about that in Bethesda. So I asked my colleagues at the National Institutes of Health, and they all agreed with me that attitude and activity couldn't possibly be as powerful as the magic bullets, as the magic bullet therapies that we had or were developing at NIH. In order to be a good debunker, though, you have to go out and meet the opposition. So I made the mistake of going out and finding the smartest people in what we would today call functional nutrition and environmental medicine and integrative science. And what I found was that I was very ignorant, and they had a lot to teach me. So what I advocate today is not what I learned in Boston or Bethesda, but it is what I would recommend, and it is the way my family has functioned. My children are now 25 and 22, and we may get into some stories about them if it's appropriate, but they have been both very rewarding young people and very high risk in terms of their health, yet they have thrived to some extent by not doing the conventional therapies, because the chance of survival in several cases with my children was 0 if we followed the conventional therapy, and I didn't like those odds. So we did some unconventional things, and they're thriving. There's an old maxim that one generation's orthodoxy is another generation's heterodoxy. That was Aldous Huxley. What I believe is the future of medicine was also the venerable past of medicine. Not very long ago, and I'm so old that I remember this, not very long ago, your doctor had a relationship with you. In fact, the doctor who bore you, the doctor who brought you into the world, might stay with you through your whole life and then might see you at the end. How many of you have a relationship with your doctor? This is a trick question. You do. Congratulations. Those of you who put your hands up, congratulations. And if it's Dr. Osborne, congratulations. Everyone deserves a relationship. Who is wise, who can inspire, who can inform, who can motivate. Most colleagues today, most of my medical colleagues today have 5 minutes with their patients. And just recently I was on an airplane sitting next to a woman who's an ophthalmologist. And so I asked her, how much time do you have with your patients? And she said, 3 minutes. And I said, why? And she said, because my business manager told me that's what we needed in order to keep the lights on. I said, who owns your practice? She says, I do. I said, what's your satisfaction in your practice? She says, I hate every minute of it. I said, why do you do it? She says, I make a fortune of money. I said, okay. Medicine used to be an art. I think it still is. A lovely fellow named Lewis Thomas, a medical doctor. If any of you are old enough to remember a famous photograph of a bunny rabbit where one of the ears fell over, that was in Life magazine and made the career of a rheumatologist, a doctor who studied arthritis, named Lou Thomas. Now, other people had injected collagenase, the enzyme that digests collagen, and collagen is the rope-like structure that you build the body out of. And my PhD happens to be in how collagen, elastin, cross-links work, so if you want to know about that, I could go on for days. But Lou Thomas was doing these experiments, and many other people had injected collagenase and showed that this unique enzyme digests collagen, and that's the structure that the body builds itself out of. But he did something no one else did, was he injected it into the ear of a bunny rabbit. And it was a very funny photo, because you expect bunny rabbits to have two ears, and they both go up. And the bunny rabbit has a left ear that goes up, and the right ear flops over. That made his career. A good picture. My mom told me that. A good picture is worth 1,000 words. So we want you to eat foods that you can digest, that you can assimilate, and you can eliminate. By digest, I mean break down to the elemental building blocks that are never immune-provoking, that never burden the immune system, never cause intolerance, never cause allergies. Healthy people don't have allergies. Not acute, not chronic, not delayed, not hypersensitivities, not intolerances. Healthy people don't have any of those. In fact, we have a part of our immune system. It's called the innate. You know, like intrinsic. The innate part of our immune system. If we're really healthy, that takes care of everything we need in defense, in repair, in anti-cancer mechanisms, in defending us against chronic infections. All of that can be done in healthy people by the innate immune system. Now, some years ago, a colleague of mine named Hugh Reardon in Wichita, Kansas, wanted to find 100 healthy people. And I've forgotten how many people there are in Wichita, Kansas. It's about 500,000. It's not a big town, but it's not a small place. After 2 years of intensive advertising, they were able to find 80 people who qualified as healthy in all of Wichita. So finding healthy people these days is not easy, because people have been eating the standard American diet, or because they've been told that symptom suppressive therapies are the first rather than the last line of care. So you want foods that you can break down, that your body can break down to the